And action. Andy wanted me to explain what cubital tunnel syndrome was. And I thought it'd be a perfect time to describe what happens whenever you pinch a nerve. You can have a pinched nerve in cubital tunnel, essentially this little thing here. You can have a pinched nerve in carpal tunnel, this here. You can have a pinched nerve in sciatica from a disc in the low back. You can have a pinched nerve from piriformis syndrome, where the sciatic nerve crosses across the piriformis muscle and causes symptoms almost like a sciatica from a disc disease. You can have it in the neck from a pinched nerve in the cervical spine. You can have it in the thoracic outlet area. You can even have it in the ankle called tarsal tunnel. Regardless, nerves are very delicate structures. They're responsible for transmitting impulse, electrical impulse, from one place to the next at a very quick speed. Now, to do that, they have to be made of this soft material, neuron, and anytime that delicate soft material gets pressed on, it will not fire properly. In fact, it'll manifest like a headache to the nerve. This is my whiteboard that shows a trapezius, a shoulder, bicep, elbow, forearm, and hand. So this is the ulnar nerve. It goes like this up until these three fingers. The hand is made up of, it gets innervated by the ulnar nerve, the median nerve, and the radial nerve. And they all come from parts of the nerve plexus that comes up here. This is the brachial plexus. All these things and nerves come out from the discs or the cervical spine spaces where the discs give space for a nerve to come out or a root to come out. Well, that's what makes up these bundles. You can have a problem with all these functioning if you have compression here. That's sometimes known as a stinger. And that's when you can have a wrestler kind of get pinned this way. It stretches out all the nerves and causes a numbness and tingling to the entire hand. You can have it when delivering a baby. And when delivering a baby, we're supposed to push the head down. The baby has the shoulders clear. Sometimes if we push too hard, you'll stretch out the neck. You get a palsy to the hand. Both those things do fine, as long as it's not too dangerous. But anyway, I have put an illustration on what happens with cubital tunnel. So the nerve, as it passes right by the elbow, which is right about here, it goes on to pass this meaty area, all forearm muscles really thick. And when it passes through or around the meaty muscle, especially if you have big forearms, Andy happens to have huge forearms. And he was actually working that morning to break up tile with a, I think it was at a 5-pound sledgehammer. And he can tolerate that. And the thing was, he was wailing at the chisel using the base end of the hammer. Usually what I would do would choke up on the hammer and use force and accuracy. He was using the weight of the hammer and really using it with momentum. So that's a lot of power necessary for that. And repetitively, that's a lot of impact. Well, you have to ask these muscles to do a lot of work. You probably have to ask these muscles to do a lot of work, but when these muscles get full, like anybody that's exercised out of nowhere, suddenly your muscles will get full. The thing with the forearm is that there's only a few compartments that make up the different muscle bundles. And the compartments, think of them as like saran wrap. And when you have a saran wrap that's really sealed properly, you can continue blowing into the saran wrap bag, but it won't go past a certain amount because it's got maximum capacity. Well, if the muscles that are contained in these saran wrap bags get swollen within the saran wrap, then they stop, they can no longer expand within the bag, and they start to crush things inside. And if there's a delicate blood vessel or there's a delicate nerve that are within the muscle, within the saran wrap, they will get crushed because the muscle is expanding so fast and rapidly. Usually until we do steroids and anti-inflammatories, relative rest, sometimes you even actually cut the saran wrap opening so that you can fillet the pressure out. So that's essentially what happens with cubital tunnel. Golfers can sometimes get it, not to that degree, but because of the forearm, the medial head of the forearm, they're responsible for this. Golfers have to golf this way. And when you, obviously I'll be golfing this way, but just to show you, when you're golfing this way, you're asking this muscle to do a lot of contraction. So when you contract this muscle, it gets big, and when it gets big repetitively, it will get swollen. And again, you have a pinching off of the nerve before it gets to these three fingers. Usually you'll feel an episode of just the hand going dead, especially these three fingers. Well, unfortunately, Andy didn't have any strength, and we were having a big problem. I cannot tell what happened with the nerve until I get studies on the nerve. And if any of you have ever had an EMG, electromyogram, or electromyograph, that is painful. You actually have to put a needle here, send a current through and see how fast it takes to get there. Needle here, needle here, needle here, needle here. You keep on sending currents through to see how fast the nerve is working. Eventually you'll find a spot where the nerve isn't transmitting, and that's the choke point. And then we say, okay, he's got an impingement there. And or the nerve is now dead, we're screwed. Cut open the muscle. So it kind of is a good test, it's a painful test, and you can't be put to sleep for that one, but it's even worse than acupuncture needles for those of you who have apprehension against acupuncture. But again, it's because of repetition usually. I've had some guys with compartment syndrome. Compartment syndrome is when you just choke off any of these, either in the forearm or in the foreleg. The foreleg, sometimes it's thought of as shin splints, but again, you'll know it's compartment because if you keep on doing the activity, repetitive activity with either walking, bouncing up and down, jumping on your toes, or repetitive handwork, the symptoms will be recurrent and they'll get worse. So usually, whether it's one of these, you can have, I just put an illustration of what I mentioned before: disc impingement, thoracic outlet syndrome, cubital tunnel syndrome, which is what I think Andy has, the Guyon's canal. You can also have this thing, which is what cyclists get. The ulnar nerve also passes right by here, and when you're riding a bike and you have your hands on the handlebar, if you're resting like this and you're riding, you can actually pinch off the nerve here and you'll get numbness and tingling to these three fingers again. It's a cyclist palsy, it's called. But that too you take care of with padding either on the handlebars or in the gloves, or just changing your position frequently. And then there's double crush, where you can have a little bit of an impingement up here, like in the thoracic area, and then a little bit of an impingement here or in cubital tunnel. With enough impingement both places, you can have the same symptoms come out as one big impingement. So it's tough to tell. It's usually by history taking and reevaluation or evaluation, physical exam. And then again, as I mentioned, the EMG. Sometimes you'll have to look further and get an MRI of the cervical spine to see if there's any impingement at the neck, where number one reason is cervical discs always bulge out, but discs are also supposed to bulge out. It's supposed to take a lot of pressure in jumping, movement. They're supposed to bulge out, supposed to bulge back in. But sometimes as you get older, the wrapping around the disc gets a little bit stiff and non-pliable. When it bulges out, it stays out and doesn't go back in. Then you have a problem because that bulge pushes against the nerve. Between the bulging disc pressure and the nerve, the bulging disc usually wins. The nerve loses and you have a pinched off nerve. So that is essentially what happens when you have cubital tunnel. I have seen some people work on massage and resting, but we couldn't even get to a splint because it was too painful, so hanging the arm down would be helpful. Problem with Andy is that we have to use these hands for typing and mousing, and he also has, as I mentioned, really big forearms and super tight trapezius muscles. So he's kind of built like a power lifter, and it's going to be tough to fix, but it is fixable. Anti-inflammatories will work, turmeric will work, magnesium, relaxation practice. If there is a double crush, we take care of this portion up here. So all that will work. Steroids would have been nice, but we can't. Muscle relaxers and pain control, we gotta maintain sleep. So those are the options. I would also send to an acupuncturist because I think Tuina, or the acupuncture meridial massages that some acupuncturists do, would be helpful. Acupuncture needles, I think, would also be helpful. TENS unit would decrease inflammation. All these things would help. It's just a matter of finding out how bad somebody is suffering, intervening depending on how severe the symptoms are, with either entry-level stuff like the herbs and the massages, or more aggressive stuff like the needling, or a lot of aggressive stuff like steroid packs, medications, narcotics. So Hopefully we'll resolve this thing real quick, but it's going to take some time. But the lucky thing is that at this point in time, I think it's reversible. So any of you guys with impingement, cubital tunnel, carpal tunnel, that's essentially how it works. Just have to unload the joint and unpinch the nerve because it's asking for some help.